One of the most underutilized financial instruments that I see as I help individuals with their finances is this the health savings account. Now, the health savings account has a lot of different features and benefits associated with it. And part of the reason why I think it is generally underutilized is it is a little bit more complex. So, hang tight with me. We are going to break this down and hopefully put you in a financial position where you're really able to maximize this type of account for your long-term financial benefit. So, what are HSAs good for? Well, they're primarily designed to help you save money for healthcare related expenses. Think of it as a way to pre-fund your medical bills, whether it's a doctor's visit, prescriptions, dental or vision care. As long as it's a qualifying medical expense, this type of account can be used for that. But what makes the HSA really stand out is the ability to use it for more than just medical costs. You can save for the future, which is especially helpful when you're planning for financial independence. Now, the amazing thing about the HSA is if you have excess funds and you're beyond age 65, you can take withdrawals from this type of account without incurring a tax penalty. Now, you will have to pay income taxes if the withdrawals are not for qualifying medical expense, but it essentially becomes like a backup, traditional IRA account, which is really, really neat. So let's talk about the tax advantages. When you make contributions into the HSA, the current year that you make those contributions, it reduces your adjusted gross income. So it reduces the tax liability that you have in the current year. Now, if you decide to invest funds within the HSA, the funds, as they grow and they compound, grow tax-free. Moreover, as long as you take the withdrawals for qualifying medical expenses, the withdrawals are also tax-free. So having an account that is triple tax-free is really hard to beat. Secondarily, the flexibility of this type of account. You can use your HSA funds for a wide range of medical expenses, and unlike an FSA, which you may have heard about, the balance of the account, as long as you're not taking withdrawals, rolls over from year to year. So an FSA, for example, if you don't use the funds at the end of the year, you actually lose the balance in that account. So I think a lot of people get that confused, but the HSA, those funds stay with you. And like I shared earlier, if after age 65, you can take withdrawals from it and it doesn't have to be a medical related expense, you will pay income taxes, but again, becomes like a secondary retirement planning account. So HSAs, the third advantage to them is they do allow you to invest funds in the account. So if you're not taking withdrawals in the current tax year for medical related expenses, you can really compound and grow the assets that are in this account over time. Now, let's go through some of the challenges associated with an HSA. In order to qualify for this type of account, you do need to be enrolled in what's called a high deductible health plan. These types of plans tend to have higher out-of-pocket expenses before your insurance kicks in. So that is one of the things that you do need to be prepared for. So if you have a year where you're having a lot of medical services, just make sure that you're choosing the right plan, looking at both the premiums and the potential out-of-pocket exposure for the plan. Now, the second challenge that comes associated with HSAs is if you do decide to invest these funds, just like investing in a mutual fund or in a brokerage account, there is going to be some volatility associated with the funds. The nice thing about it, again, is as the owner of the HSA, you're going to have complete control in how these funds are invested, but that is something to make sure you factor in and make sure that you have enough funds set aside for short-term expenses. And so that way, the funds that you may use in the short term aren't subject to volatility. So this challenge can be controlled, but you do need to be thoughtful going into it. Thirdly, one of the last challenges that I'll highlight here is the complexity. While HSAs are fantastic, they are not always easy to understand. And if you do take withdrawals from your HSA for qualifying medical expenses, you do need to make sure that you're keeping good records and tracking the various expenses. And so that way, if you're ever to be audited by the IRS, you have the records to demonstrate that all the withdrawals that you've taken from this account should be income tax free. So hopefully this was helpful to you. If you do have access to an HSA and you are enrolled in the high deductible health plan, I very much encourage you to look at this and look at the different ways you can use this to help empower yourself for long-term financial independence. If you do have questions, feel free to reach out. I'm always happy to help. Thanks for tuning in.